are going to not delay and get right to Dr. Wing Province from Park City Hospital. He's joining us virtually. Dr. Province, thank you for being here today.
Morning, Christine. Thanks for having me.
It's great to see you. It's, as I mentioned, really surreal, I have to say, that we're coming up on that anniversary of when things shut down, when the pandemic started right here in Park City. And I'm curious, when you look back over this past year, what stands out to you? What did you learn? What are you going to take with you as we head into this next year?
I agree, Christine. I'm coming off an overnight shift and talking with the nurses overnight. We were we couldn't believe it's been a year. And in some ways, it feels like it's been longer than a year. But overall, I think I've learned a lot, from a system perspective, as an industry, I guess I should say, of healthcare. I'm marveled by how quickly we were able to respond to this, to be able to create diagnostic tests as quickly as we're able to be able to create a vaccine as quickly as we've been able to see the federal regulations that have changed that have allowed this kind of innovation. I've been impressed with organizations who have typically been competitors become frenemies, so to speak, as, for example, here in Park City, the University of Utah and Intermountain joined together for testing at the beginning stages of this pandemic. I think really, most of all, this pandemic has really been a mirror for us as individuals and as communities and as a nation to really have a chance to look and reflect and see who we really are. I can't help but be impressed by the selflessness that I've seen by so many people, especially in our county, here in Summit County, wearing masks, doing the social distancing, making those personal sacrifices to keep us safe. I've been really impressed with that. And I think, on the flip side of that, you see those who have really struggled with doing those things. But ultimately, I'm very optimistic and impressed with how our community and individuals have responded in the wake of this unprecedented pandemic.
Dr. Province, you had the opportunity to participate in a program where you traveled to New York and helped treat patients in a hospital there, something that we have spoken about on the show, but you have some time to reflect on that as well. And what are some things that you will remember from that experience of being able to see the pandemic in a whole different environment?
Yeah, certainly memorable experiences I will never forget. I think the resilience of the healthcare workers out there, seeing them having lost many of them to COVID, and even when I was there, our medical director in the emergency department taking her own life, helped me realize the deep emotional burden and toll that this pandemic has had on us. But I was also, in that, being able to see resilience. I was able to learn a lot and bring a lot of those lessons back. I was able to see a whole city that was known for its differences culturally, linguistically, people from many different religions and colors of their skin all coming together and making those sacrifices that they needed to keep this pandemic under control there in New York. And being able to see very similar behavior here, very altruistic behavior out here. I also learned a lot about medicine and about this disease, and was fortunate to learn from some of their experts there and bring it back here. And I think we've done a great job of applying those lessons, not just the ones that I brought back, but as you mentioned, there were 100 of us who went out there who brought back those lessons and hopefully prepared our community. And I think part of that has to do with why here in Utah we've had such low mortality rates. I think it's because we had the advantage of learning from our colleagues in other parts of the country who didn't have a chance to learn from others before this hit them.
What is the state of what is happening at Park City Hospital right now in terms of COVID-19?
It's pretty optimistic, but cautiously we need to have optimism. But right now our numbers are coming down. We're not seeing quite as many COVID patients in the hospital or in the emergency department. We're seeing a lot more traumas coming in from the slopes. But numbers are coming down throughout the county. But as I mentioned, we need to be cautious with that. We can't get overly confident. I'm seeing a lot of different states around the country who are getting rid of those guidelines that really got us to this point where we can be celebrating how close we are to really controlling this pandemic. I liken it to watching somebody catch a deep pass in a football game and then starting to celebrate at the 5-yard line and then getting tackled right before they cross the going in into the end zone and actually scoring a touchdown. We need to be cautious that we're not making those kinds of foolish victory dances before we actually get into the end zone. And I worry about us getting too overly happy and optimistic. But certainly the numbers are looking good and in the direction that we want to be to get back to some semblance of normal life.
We are hearing positive reports from the vaccination distribution right here in Summit County. How are you feeling about how that's being done? Do you feel that it's been efficient? Are you pleased with the progress of how the vaccine has been distributed throughout our county right now?
You know, I think Park City and Summit County residents really ought to be proud of where they live. We are one of the best counties in getting our community vaccinated. In fact, I'm just going to look down, because I just got hot off the press some information here. For those individuals who are 70 and over, we have 80% of them who have received a vaccine. Those who are 65 and over, also 70% vaccinated. Those who are 40 and over, about 35%, and those who are 18 and over, about 36%. Also, at the Park City Hospital vaccine clinic, we've received data that shows that we actually have the fastest throughput in all of the Intermountain system. You can come in, get registered, be observed for 15 minutes after you receive your vaccine, and all that done in approximately 20 minutes, which is just pretty incredible. And the volume of patients that we're seeing and vaccinating is pretty phenomenal as well. Last week, for example, in 2 days, we were able to vaccinate 1,000 citizens of our county. So just really impressive numbers. I'm really pleased with what we're doing here. And I should also give a shout out to the county health department right across the street. They're also having a high throughput number of individuals there and getting really partnering with us hand in hand to get this pandemic under control by vaccinating our citizens. It's very impressive what we're doing here in Park City.
And Dr. Provence, in your opinion, as an ER doctor, many things have been mentioned about the vaccines and the different vaccines that are available or may be available. What is your take on that? It seems that the messaging right now is to just get whatever vaccine is there when you go for your appointment. But there's also been a lot of debate about that. How do you feel?
You know, I know in Park City, brand names matter. You know, I was at Park City Mountain the other day, and I heard some people talking about their skis and what brand they have versus another. Same thing with their ski jackets. I will say that in some matters, maybe brands are important, but when it comes to the vaccine, to your point, Christine, brands don't really matter. Some of the new vaccines, like the Johnson & Johnson, for example, allows us to store that without having to have one of those big fancy freezers, and we can vaccinate people with just one dose. Moderna and Pfizer and Johnson & Johnson, all three of these vaccines show that they reduce death and they reduce hospitalizations. And really, that's what matters most as it comes down to what are we looking for in these vaccines. It's the ability to reduce the burden on the healthcare system, to reduce the negative impact on the quality of life of individuals, and as I mentioned, ultimately reduce the number of deaths. And all three of these vaccines are doing an excellent job with that. So if you have the chance and you go to the hospital or you go to the Summit County Health Department's vaccine clinic, I would recommend, highly recommend that you take the vaccine that's available and don't hold out for another one.
And depending on which vaccine you get, you'll always have that first dose. You may have a second dose a month, a few weeks later, or you may just get the one dose vaccine. How does this affect immunity? I know that you need to wait a couple weeks after the second dose if you take that vaccine for full immunity, but does immunity build over time? Do you have more immunity after that first dose, and how is it different with the one dose vaccine?
Yeah, really great questions, Christine. And I think we're learning as we go along, particularly with all the different SARS-CoV-2 variants that are coming from around the world. But you're exactly right. Your immunity is at its best 2 weeks after you receive the vaccine. As you comparing the different vaccines, there seems to be pretty equivalent rates as far as its efficacy, as I mentioned, against severe disease. And, you know, as far as the variants go, the best thing that we can do to reduce those variants from happening is actually getting vaccinated. See, the viruses cannot mutate unless they're in a host. and they can't really get into a host if we're vaccinated against them, and they're eradicated from our bodies by having those antibodies against them. So I think the best thing we can do to have immunity and to create herd immunity, which is our, the gold standard or the target that we're shooting for, getting as many people vaccinated as possible. Then there's fewer mutations, and we can get this really under control here locally in the United States and really around the world.
Dr. Wing Province, thank you so much for being here this morning on Park City Television, especially after an overnight shift. We always appreciate you taking the time to give us up-to-date information, good, clear information, and keep us safe and healthy during this time. We'll be back with more right here on Mountain Connections right after this.